At the beginning of my talk about offenders, I really think it's important to define from the get-go what is the population I will be talking about and what is the population I will not be talking about. I will not be talking about people who are using drugs with different degree of drug involvement and they have not committed any crime. These are people who should not be in prison to begin with. They should be offered good quality treatment. So this is not the population I will be referring to. I will be talking about a relatively large, rather large, sizable group of people who have some degree of involvement with drugs, and they have some degree of involvement in criminal behavior. So there is a co-occurrence of two types of behavioral and life problems, the drug involvement and involvement in some criminal trajectory. Okay. There is clearly a very well-established correlation between the severity of drug use disorders and the likelihood of criminal involvement. And it's pretty clear there is an exponential increase in the chances that the person will be involved in crime with the raising severity of the problem. So what is happening now? Okay, so here is what we know from science. There is absolutely no evidence that punishment or threat of punishment actually can sustainably result in both recovery from substance use disorders or reduction in criminal recidivism rates. Actually, there is a number of studies suggesting that young people, people younger than 25, if you place them in prisons, you're actually making them worse from both perspectives, perspective of substance use disorders and criminal involvement. This is the evidence of this. Meta-analytical studies show that with punishment and criminal justice sanction only, you will actually increase criminal recidivism in some. But if you offer treatment, actually this is the result that we would like to get. And it's quite understandable, because with punishment or threat of punishment, you can suppress behavior quite easily. The problem is that the suppression is not long-lasting. You will be able to suppress behavior only for as long as you have control over the person. And the behavior that you're trying to suppress will come back almost immediately as soon as your control fades. So it's not surprising that punishment does not help much. What are the goals of the interventions with substance-involved offenders? Definitely one of the goals is to help them to accomplish, to achieve some level of recovery, and then to assist them to sustain and maintain the recovery. At the same time, one of the key goals, equally important goal, is to reduce the chances that they will commit another crime, they will be repetitively involved in crime. In other words, one of the goals is to reduce criminal recidivism. In order to do that, we have a number of options with exponentially increasing intensity. From the minimum invasive, minimum intrusive interventions, programs like diversion programs, through the a little bit more intense interventions like probation, drug courts, all the way to the most intensive and most intrusive and definitely the most costly intervention like incarceration. What if we rely on incarceration only? What will happen if we put all the drug-involved offenders in prison? We have done it historically around the world. This is not a new thing. And we know quite well what will happen. Here is what will happen. Almost all of these people 3 years later will be rearrested, and almost all of these people will relapse with drugs and alcohol. Doesn't sound like a good idea to me. Okay, what if we rely on treatment only without any criminal justice involvement? Well, we know what will happen. Most of these people will never show up even for intake assessment. And if there is nothing else other than just some low-level, low-intensity treatment interventions, actually they're not getting the enough dose of treatment. They will never stay long enough to receive enough necessary amount of treatment. Okay, so it doesn't sound like a good idea either. So if we use only public health approach, only treatment to this population, we will have very high attrition rates. If we use only public safety approach, just putting them in prison or using criminal sanctions, we will have very high recidivism. Doesn't sound like each idea is good by itself. But what you can do is to combine the two in different fashions, utilizing the benefits of both systems, blending some of the positive things that criminal justice system can give us, at least from the perspective of the initial push, and then using the best therapeutic strategies, different therapeutic strategies for a variety of people we're working with. So what doesn't work with offenders? There is a number of treatment interventions that have been carefully studied, and there is absolutely no evidence of effectiveness, although they're still pretty commonly used around the world. Fear-based approaches, boot camps, shaming people, blaming people, isolated drug lectures, psychoanalytical approach, low-intensity 12-step groups alone, without anything else. Punishing smarter, just say no, harsh confrontation, self-esteem building, so people are still criminals, but they feel good about themselves. This is not what I really want to accomplish. These are programs that have been studied very carefully, and their effectiveness with this population is zero. So I really want to make sure that we are not wasting public money on doing something that doesn't make much sense. There are so many pieces. We're talking about people who have basically two problematic areas, but in fact, the number of problematic areas is much larger than two. Mental health, medical health, homelessness, high impulsivity, unemployment, lack of support, all sorts of things that you can imagine. There is a number of effective treatment interventions, meaning these are treatment modalities that have been studied carefully in a large number of studies with good methodology, and they do show the effect that we are looking for, meaning reduction in repetitive criminal behavior and increased rates in people who are entering recovery and then they sustain recovery. These are some of the commonly studied types of intervention: residential substance abuse treatment, cognitive behavioral interventions of different sorts depending on the target behavior, motivational interviewing, contingency management, medications, some medications, although not medications alone, drug court interventions. So these are some of the, this list is not exhaustive, but these are some of the most commonly used and very well studied interventions for this population. So when we have to decide which program or what type of intervention to implement in your country or in your region or for this specific population, we need to answer 4 questions. Whom do we treat? What exactly do we treat? How do we treat it? And how well do we do that? What is the fidelity level? In terms of answering the question, whom do we treat, I will share with you a huge secret, and I'm sure you don't know that. So please don't tell anybody. The clients we refer to as drug-involved offenders are very different. Okay? I'm sure you've never heard that. But just believe me, these are very different people. They have different needs and different risk level, and everything is different between them. Some of them will respond better to treatment interventions than others. So we need to decide who is more likely to benefit from the type of interventions I'm talking about. In order to do that, we need to measure 2 factors: risks, and these are some of the most common criminogenic risk factors. You remember, one of our goals is to reduce the likelihood of repetitive criminality. So in order to do that, we need to measure, to use some tools and measure how likely this person will commit another crime. These are some of the most common criminogenic risk factors. At the same time, I will skip some of the slides. At the same time, we need to measure what are the needs. Needs are personal attributes that may or may not be directly linked to criminal behavior, but they are somehow related to repetitive dysfunctional behavior. And by the way, one of the most common, probably the most common need that this population have is substance use disorders. In addition to that, there is a number of other needs that must be taken into consideration in our selection of treatment interventions: housing, mental health, unemployment, low socioeconomic status, low support from the environment, and a bunch of other things. But the most common need is drug use disorders. Okay. Now, when we have two variables, risks and needs, when you combine them, you have four possible combinations. The high risk, high needs, low risk, high needs, high, low, and low, high. What does it mean? These are populations, subtypes, that respond differently to different interventions. Some of them do better than others. For some of these groups, I would not suggest treatment at all, and you will understand why. People who are high risk and high needs, these are people who started with crime and then they started using drugs, meaning there is an equal proportion of criminal activity and drug use. People who, and for them, a combination between accountability, meaning a little bit of criminal pressure, and very structured, usually long-term treatment is necessary. Low risk and high needs are people whose criminal behavior is secondary to their drug dependence. So the primary problem is drug dependence. Without that, they would have never been involved in crime, okay? For these people, you need minimum criminal justice sanction, or maybe sometimes you don't need it at all, but they do need a very structured treatment and social support and recovery management. High risk and low needs people, I have a good news, I have a bad news. The good news, these are very few people. The bad news, they commit a lot of crime. These are antisocial psychopaths, and there is very little evidence of effectiveness of anything. So this is the population that presents significant risk from the public safety perspective. And low risk and low needs people, these are people who do not have neither criminogenic risk factors, nor they have any evidence of drug dependence. These are people who just happen to do, forgive me, something really stupid, and they got arrested being drunk. And these are people who, even single night in the jail or the police, they will spend the night in the police, will be enough for them not even to think about drinking again, okay? These people don't need any intervention because they will be fine anyway. Our treatment programs are actually full with people like this because they make us feel good. They're compliant, they don't cause any trouble, they're fine. But in fact, you're wasting resources because these folks will be fine anyway. The two groups that really give us the best outcome, if we provide them with both a little bit of criminal justice push and very structured and intense, typically, treatment interventions, are these two. High risk and high needs offenders and low risk and high needs offenders. This is the outcome that policymakers should be looking for, and these are the subpopulations that will give you the best return on the investment should you decide to develop treatment programs for substance-involved offenders. I have a bunch of other slides here. This is just the evidence of what I'm saying in support of what I'm saying, the meta-analytical result of a large number of studies showing pretty much the same thing. If you do nothing, you will have very high drug relapse and criminal recidivism. If treatment was offered but the person dropped out from treatment, meaning did not complete treatment, the outcome is pretty much the same like in never treated group. If you offer people treatment in prison which was not followed by anything in the community, the results are a little bit better but still not very good. But if you offer people both treatment portions inside the prison correctional institution and then for at least 6 to 12 months transitional care in the community, this is the result you're getting. There is almost threefold decrease in drug use and threefold, more than threefold decrease in criminal recidivism. So it does make sense to do. I have very similar data for the drug courts. Even high-risk offenders, they do better in drug courts operations. So this is another treatment strategy that I would suggest you to consider before sending people to prison. Folks, let me, to end because I have to rush. You can definitely do whatever you want in your countries, and you can, it's your country, your decision, you're sovereign people, I'm not telling you what to do. But should you decide to use prisons as a way of intervening with substance-involved offenders, let's remember, prisons all over the world, regardless how they look like and what is the furniture inside, All the prisons in the world have incapacitating effect, all of them. Prisons incapacitate people. And this is just the opposite to what we want when we think about effective interventions in people with substance use disorders. We want to empower them and assist them to change the problematic areas of their lives, not incapacitate them. Thank you.